Another domino in all of this is how much of a burden has been placed on paramedics, the other frontline workers. What does crisis standards of care mean for those tasked with taking us to a doctor in an emergency? Ada County paramedics told us today they are busier than ever before right now. Now, sure, some of that has to do with our increasing population, but some of that is also related to the coronavirus. How busy has it been lately? We're told, on average, Ada County paramedics transport about 70% of the people they help. Before last May, they've never had 3,000 calls in a month, they told us. Since May, they've had more than 3,000 calls every month. And we're told when it's bad, well, they've dealt with 12 to 16 COVID patients a day. But the good news, as of now, they are not expecting crisis standards of care to have an immediate impact on how they can help people.
About the only change that we've seen, in the last few weeks is one of the hospitals might not be as able to take patients in the ER, but really not a lot has changed for us in the field for paramedics. Some things that we may do differently in the future would be things like, navigating a patient to a more appropriate level of care as opposed to everybody going to the ER, but we're not quite there yet.
So navigating a patient means where they take them. And in normal times, they take patients to a hospital of preference. Unless it's a critical emergency, then they go to the closest hospital. But if conditions get worse, paramedics tell us they might have to decide if that patient would be better served going to an urgent care or their own doctor's office instead of an emergency room. And this, of course, is going to put an extra burden on paramedics who are already getting geared up in full PPE for every call they go out on because, well, they don't know the COVID status of the patient. And they're also under the same stresses, some of the same stresses that is, as other healthcare workers. And they've been under them for the last 18 months. Busier than ever means working extra hours, and now you add those layers of crisis standards where they may not be able to take someone to the nearest hospital because that hospital can't help them.